It is the famous ribbon cutting. Hey guys, it's Shay. Thanks for tuning in where we talk about beauty, nursing, and lifestyle weekly. Today I'm bringing you guys a super fun video. We're actually going to be preparing my clinical bag. So if many of you guys watch me for Vlogmas or watch my last video, you know I am prepping for a new semester. I picked up a new clinical bag and I'm just going to give you guys a quick sneak peek of what is in here along with how I'm going to prepare for my first clinical day of my next semester, which is tomorrow. So if you are interested in seeing what's in my bag, be sure you stay tuned. If you're interested in seeing what bag I have, make sure you stay tuned and let's go ahead and jump in. Alright guys, so I'm pretty sure you've seen in the beginning clip my famous ribbon cutting of my bag. This is a Wild Fable bag. I purchased it from Target. I think I only paid, if I remember correctly, 30 bucks. I'm going to try to link the bag down in the description box below. But this is a really, really nice bag. It's a great size and the quality feels great and it's going to go perfect with my white coat. So basically I'm just going to be showing you guys what we're going to be throwing back in here so I can take to clinical tomorrow. So we are going to start off by just saying I'm the bag lady. When I tell you I'm the bag lady, if you watch my nursing bag video before, you know this. So I'm including bags and bags, but I'm going to try to be very simple, guys, on this terms because we know with the current pandemic, it's not really beneficial to be bringing tons of stuff in and out of the clinical setting. So let's talk about what I have and what I call my go bag first. So I'm beginning by showing you guys what is known as my go bag. This is just a small compact bag that's going to go inside. Basically, what I have in here is what is needed for my own personal care. So not too big, just the perfect size to drop in the bag so you guys are able to, you know, take care of yourself throughout the shift. Some of the examples of things that I'm carrying is I have a little bottle of ibuprofen. This is the Equate brand, just in case there's like any headaches or any pain during my clinical day. I'm also carrying this intensive cream by Dove. If I remember correctly, I think I got this from the dollar store, but basically this is good for keeping your hands moisturized, especially between washing your hands a lot with, you know, all the hand hygiene we have to do, especially now. I have lip gloss in here. I have a Tide to Go pen, which is perfect, guys, especially if you're wearing any type of white in clinical. This is going to be very beneficial if you have a quick stain. You can easily just pop the top off this bad boy and go over where you have the stain, and it'll either get rid of the stain or help decrease its permanent damage when you wash it. So I really love the Tide to Go pens. Other things that I have in here is just a pack of tissues, some sanitary napkins, and of course I always carry me a deodorant wherever I go. These little mini native deodorants I found in the travel section of Target. They are perfect. You guys know I'm on an aluminum free journey. I've been using native for a couple months now, and you see how easy and compact these are. It's not my big one that I paid $11 for, but it's definitely one that I can just throw in my bag on the go. The next bag I'm showing you guys is what I call my essentials bag. And let me just shout out Five Below real quick because that's where I picked this bag up for only $5. And I feel like it's perfect to hold everything that I have in here. So the essentials bag for me, guys, is literally everything I need while I'm in clinical. So we're going to pull a couple things out of here. Again, I'm not going to go through everything completely. Mainly what I have on the back side is just some utensils, pens, pencils, highlighters, a pencil sharpener. I always bring tons of writing utensils. I really like the 4-click pens. They have all the different colors. The one that's most pronounced for clinical is like the black, blue, red, and green one. I do have one I have to grab and throw in here, but I do have a couple extra pens in case any of my pens run out or anything like that. On the other side is literally, like I said, the clinical essentials. The first thing I'm going to show you guys, of course, is my stethoscope. So many of you guys know I purchased this. This has been on my wish list for a while. This is the rose gold and black MDF stethoscope. I will tell you guys straight up, so I own 3 stethoscopes currently. I know, crazy, but a nurse is a nurse. So I have the Littman Cardiology 4, I have the Littman Lightweight, and I also have this one. My Cardiology 4 I use at work, and I was using interchangeably at clinical. Now this semester is going to be my first time using the MDF on patients every single day, so I'll actually be able to update you guys soon and let you know which one works better. I still think my Cardiology 4 is going to put this one, you know, out the business as far as the acoustics, but otherwise I think this one is pretty decent, and it's probably even better than my lightweight. I know they say the lightweight is a beginner stethoscope, guys, but honestly, I feel like that stethoscope does not have the acoustics you need, especially when you have a beginner's ear in nursing. So I will let you guys know how I feel about the MDF, but look at the aesthetic. Y'all know this stethoscope hasn't touched anybody but my parents, so I mean I always try to keep one so like if I have to do anything at home for anyone, but I think it's time for me to just see how it will work in the clinical setting. So what better way than in primary care? Some of the other items that I have in my essentials bag is like an eye Snellen chart. It's a pocket chart. We have one right in the office, but it's great to have another one on hand just in case. I also have like a measuring tape, so that'll come essential if I need it. There's like a pair of scissors, some tape, other things in here. I have an otoscope and ophthalmoscope, but I don't bring either to the office because they have them in the office already, so it's pretty much pointless for me to, you know, bring extra supplies. Like I told you guys in the beginning of the video, not only are we going through a pandemic, but just in general, you never want to bring a whole bunch of stuff when you're already supplied with what you need in the first place anyway. Alright guys, so let's talk about note taking in the clinical setting. I have tons of stuff here. Again, as I mentioned before, I'm in primary care. I honestly feel like if I was in the hospital like I am for work, I would not have all the stuff that I do. But because I'm in more of a learning setting too, it's also required that I have things on hand in case I need to jot down notes really quick. So first thing, I already think I showed you guys last semester, is just this simple index card folder. I use this basically to put anything like labs or tidbits that I want to continue to remember for each clinical each semester. This is very good because it fits right in your pocket. Example, I think I showed you guys this before. I have just like some lab values on the front, my TSH levels, hypothyroid, hyperthyroid. I have some cholesterol levels. I have some medications that are good non-benzos for anxiety. So just good tidbits or good information I feel like my clinical preceptor from last semester shared with me. Of course, do I need to explain having a notebook? Just so I can take notes as needed. I use a notebook a lot just to jot down notes on the people who I am going to do my clinical notes on. It's just easier for me rather than, I know I'm a paperless student now with the iPad, but just bringing the iPad back and forth from clinical, home, and etc. I just feel like a notebook works a lot better for me. What I didn't show you guys last semester, but you might remember from my nursing bag video, is my foldable clipboard. Guys, this is bae. So I did not buy a new one. I'm actually using the same one I had before. I no longer use this in the hospital just because of everything going down with the pandemic, but I am definitely going to use this in the clinical setting. It's going to be easy for me to just put like patient notes and things in here, and then again I can just fold it up, stick it in my pocket. Some of the information that's included on the charts, and I'll just put them up real quick so you guys can see. There's a pain scale on here. There's some chemistry levels, your Chem 7, your CBC, your LFTs. Injection sites, I think that's really good. ABGs is also nice. And then, like I said, on the other side, there's like a pain scale. There's some things for sepsis. They have information about EKGs and like the rhythms. And then they also, I did not notice we had a height, weight, and temperature chart. Like, I've been needed that. Like, I'm always trying to convert from Celsius to Fahrenheit. So this comes very in handy, guys. If you don't have one of these, I will try to include an Amazon link below, but I feel like it's very beneficial in the clinical setting. Even if you're a clinical student going into the hospital, it's easy to wipe down. You can use bleach wipes, you can use whatever, and just keep it like out in a bag that you only use when you're there. But I feel like the back charts really help with, you know, keeping track of just the small things in nursing. There's even a ruler on here. I didn't notice that either. And again, it's foldable, of course, so that's definitely a plus. Alright guys, some of the last things I'm going to mention. So the first thing I'm going to show you guys, I did purchase a Google Chromebook. I'm not a big fan of Chromebooks. You guys know I have a Mac, but I did purchase one because I felt like it would just be easier for me to carry this in and out of clinical versus my Mac. Now my Mac is lightweight. I have a MacBook. What do I have? I have a MacBook Air. So I have a MacBook Air. It's lightweight, as obviously it says. It's easy to throw in my bag and throw out. But I need something that was more like clinical focused. You guys know I do everything for my MacBook. School, YouTube, etc. So this Chromebook is just for mainly like school and clinical. So I use this to log into Typhoon and, you know, put my clinical documents and notes in my hours. If I have downtime while I'm at clinical, I will certainly use it to like work on some work. You guys know I'm using Google Drive this semester, so Google Drive is directly linked with Chromebook, so it makes it so easy for me to just pull up my documents while I'm at clinical. And like if I can do a quick little thing, you know, every second is precious in nursing school. No second is a second wasted. There is no free time. Use each second you get to your advantage. Okay guys, the last couple things I'm going to mention are super simple but super essential, especially right now. So I had a 2-pack of face shields. I threw the one out from last semester that I used, but this is the new semester one. It is a little bent in the center, but it'll be good for now just to, you know, fit over my head and my face and just keep me at bay. My hair is probably going to be back or something. Why am I putting this on and I don't have to talk to you guys? So yes, face shield. I'm also going to go on Amazon. They have a couple ones that my coworker actually sent me recently that are really nice. They have like a thick band or like a nice thin band, but it's very durable. So I'm definitely going to look for that, and I can include it in the description box. A lot better than this one. But I mean, I'm not saying this one is horrible. Like, it does the job. I do have a little premium hand sanitizer in here that I'm going to include probably in one of the side pockets. I know they have a lot in the clinic, but it's just good to have on hand. I also, although I had the lotion before, I have a Nivea cream. This is very good for dry skin, very good for nourishing those hands after dealing with the sanitizers and the soaps from the clinical setting all day. And I do have like a little pack in here, and this is my first aid kit. So basically in here I just have like band-aids, gauze, alcohol swabs, things like that, just in case there's any like first-hand like emergencies. Even with myself, I get a paper cut, something like that. Like, it's just very simple. Wow guys, I can't believe I did not film an outro to this video, but as you can see, I'm just getting all my stuff packed in my new bag and ready for clinical tomorrow. I want to thank you guys so much for watching. If you have any ideas of more things I can add to my bag, please let me know. If I was able to inform you about anything that you did not know about, also let me know. I love to know what you guys benefit from when I share. Make sure you stay safe during this season. If you're getting ready for school, work, whatever it is, stay safe, wear your mask, wash your hands, and take care. I will see you guys in my next upload. Make sure you subscribe on your way out and give me a big thumbs up. Thanks for watching.